Nobody wants to implicate vaccines, but that needs to be looked at very, very closely. And I don't believe it's been looked at closely. Um, there is a paper out that's just an epidemiologic paper. They looked at autism from 1970 to essentially, 2022, and they tracked the autism rates in the United States, uh, the United Kingdom, Western Australia, and Denmark. And they just noticed change points. It was at baseline, then all of a sudden it bumped up, and then it bumped up again. And like in the United States, they discovered 7 change points. In the United Kingdom, there were 6, and they were all different years. And then they correlated that with paternal age, because some people think paternal age has something to do with the autism epidemic. And when they plotted out paternal age, there was no change. It didn't correlate with the change point at all. Then they looked at a variety of other factors, including when they changed the diagnostic criteria, because a lot of people say, "Oh, we're just diagnosing it better," but it didn't correlate with the diagnosis. Then they looked at vaccines, and every single change point in every single country correlated with the addition of an aluminum containing vaccine. That when the vaccine was added, the change point, the rate went up about 2 years later. And since every country had different change points and they introduced the vaccines at different times, it really correlated well. And there's now separate studies that the aluminum in a vaccine that you get injected in your arm can go to your brain and actually stay there for a year or more. And so um, that needs to be looked at. And just because you and I, we probably got 3 vaccines, you know, but now before the age of 6, these kids are getting 72. And some of this is crazy. There's no reason that the vast majority, 99% of children, should get a hepatitis B vaccine, at birth. Hepatitis B is spread through sexual activity and shared needles. Um, you know, uh, and there's even questions about the chickenpox vaccine. When you and I were young, when somebody in the neighborhood got chickenpox, your mother sent you down to to get the chickenpox. And the chickenpox, actually, it's a very interesting, because as soon as they started a vaccine of chickenpox, that's when the shingles outbreak started. And what they noticed was the more they vaccinated kids, the more older people got shingles. And the current theory is that, you get the chickenpox, and then when your children get the chickenpox, you get exposed to them again. And then when your grandchildren get chickenpox, you get exposed to 'em again. So you all have this lifelong immunity, which is why only people on their deathbeds ever got shingles. But as you take it out of the population, that puts everybody at risk for secondary shingles infection. So that's being looked at. And then I think this is a big one too, is that inherently, um, obese and overweight women have more inflammation in their uteruses, and that's been shown on studies. And currently, 2/3 of all women in the United States getting pregnant are overweight or obese. And so that is an absolute risk factor for having an autistic child now, is being overweight, obese when you're pregnant. And so, and that's been shown. It's a variant of what we call maternal immune activation. But instead of the inflammation coming from infection, it comes from, fatty acids are very inflammatory, which is why when they hit your bloodstream, your body takes them out and makes a fat cell out of it. And so people that are overweight and obese have this baseline inflammation that's higher than most people, which is why in the long run, they end up with diabetes and hypertension and heart disease and metabolic syndrome.